His official death count right now is 23, but of course officials think it's going to go even higher than that. So it's been 48 hours now since Ian made landfall near Fort Myers. We know you're going to work with FEMA once you get there on the ground to kind of triage the scene. What do you do first?
I think from the overall perspective, of course, continued rescue and providing shelter is important. On the medical side, though, people didn't stop having emergencies just because there was a hurricane, but a lot of people have had difficulty reaching the hospital or getting to medical care. Their doctor's offices have been closed. And so it's trying to find those people who have not been able to receive medical care, identify the emergencies, and then for those who need ongoing medical care but haven't had access to their medications, haven't had food or water for a couple of days, finding those individuals, assessing them, and obviously providing what they need.
Well, I'm talking about the caregivers as well. So many residents either evacuated before the storm, maybe hunkered down during it. But of course, that wasn't an option for doctors, nurses, many of them just working around the clock. So what are you hearing about the other challenges they're facing?
I think obviously at this point, many people are exhausted. They have been working so hard, as you said, and honestly, also it's really hard because many of them know that their homes have been damaged. Some of them have friends and loved ones who may have sustained injuries, and so it's really hard to keep going. One of the things we're most eager to do is give them support, but also some respite. And so whether it's take care of patients inside the hospital and let them go home and take care of what they need to, or just offload their overwhelmed hospitals, that's the whole purpose of our team.
And you've seen the same images, Dr. Bettinger, from the disaster zone that we have, the devastation to the buildings. The infrastructure down there is just enormous. I mean, it looks like Fort Myers Beach, for instance, has basically been wiped off the map. But as a physician, what can you tell us about the human toll that takes? I mean, that was a real community where thousands or tens of thousands of people lived. What are those people going to need to recover? I mean, you mentioned some things like exhaustion and dehydration. I imagine that you kind of got to start at the bare necessities, right?
That's exactly right. And so let's reconstitute the basics like food, water, and shelter. And then on the medical side, access to care. People need to refill their diabetes medications, their heart failure medications. They need to see their doctors and keep getting care. And so those are the urgent needs. But you know, we know for sure that the consequences of an event like this go on for years. Everyone probably is pretty aware of the mental health toll, but what maybe is less appreciated is even there is a ongoing physical toll. For 5 and even 10 years after Hurricane Katrina, the incidence of heart attacks and the incidence of bad outcomes, meaning severe illness or death of heart attacks, was still increased in the area around New Orleans as compared to the rest of the country. So these things take an enormous physical and psychological toll that will take years to address well.
Dr. Paul Bettinger from Mass General, thanks so much for joining us, giving us some insight.
Stay safe. Good luck down there.
Thank you so much.